temperature. What are some routes that we can take temperature?
Oral, axillary, temporal, rectal.
Rectal. Okay. What types of patients do we take a rectal temperature on?
Super sick.
Babies. If they've had oral surgery, can you do an axillary temp?
Mm-hmm.
Yeah. Hypothermic patient, critically ill patients, we get a core temperature on. Okay? And that could either be a temperature probe in a Foley catheter, that could be a rectal probe, that could be an esophageal probe. That you guys will not be expected to know that in this class. The big things are oral, axillary, rectal, and temporal. Those are your routes of temperature. Okay? Very rarely you'll be taking rectal temperatures. Can you imagine the person walking into triage? Can I get a rectal temp? No. I think an oral or axillary is appropriate. Pulse. What are some locations that you check a pulse? Radial, carotid, femoral. What about on a kid?
Brachial.
Brachial. DP and TT pulses. Okay, so what about this pulse here? What's that called?
Can't think.
Fifth intercostal space.
Apical.
Apical pulse.
I can't say it.
Apical pulse. We'll be doing, yes.
You have to whistle with a stethoscope.
You do.
Okay, I was like.
You do, unless they're super skinny, then you can like feel it, and I mean like super skinny. Okay. But you have to listen to an apical pulse with your stethoscope, and we will be practicing that in skills lab. When you are in clinical time and you give a medication that affects a heart rate, you will be expected to listen to the apical pulse and count it and follow the doctor's orders. If it's less than 60, we're gonna hold it. If it's more than 60, we're gonna give that medicine. Okay, so we have radial, carotid, femoral, apical, DP and TP, so dorsal pedis. On a child, what's it called?
Brachial.
Brachial. Can you also feel a brachial on an adult?
Yeah.
Yeah. Okay. Respirations. When we assess someone's respirations, we are watching them breathe. We're looking at the quality of their respirations. If they're hunched over in bed, they're working hard, right? Do you think that's quality breathing?
No.
No. They're in distress. Yep. Do we tell someone we're counting their respirations when we're doing
No.
it? No.
Let me check your pulse.
Then we hold their breath, right? The time to assess respirations, and we'll teach you guys this, is when you're assessing the pulse. Okay? Kind of got to multitask. It takes practice. A lot of hand-eye coordination. Okay? So respirations, we're looking at the rate, the quality, the depth of respirations. Okay? The blood pressure. How can we assess a blood pressure? Manually, so that's with a stethoscope in your ears and a stethoscope and pumping it up ourselves. What's another way?
Monitor.
Pressing the button on the monitor. Okay. Where can you do a blood pressure? Arms, legs, calf, never around the neck. If you had a patient that had a mastectomy or a procedure where they had, let's say, a lumpectomy, or they've had radiation on one side of their body, or lymph nodes removed, you do a PICC line, you do it on the other arm. Yes.
So if you have like a double mastectomy, do you have to do it on your thigh or your leg then?
Not necessarily. You can ask the patient.
She had lymph nodes on both removed and her breast, so.
If they have a fistula, you don't take it on that arm. Okay. Yes.
What's your pick line?
A PICC line is a central line, so it's an IV catheter that's yay long, okay? And it goes into the arm. So instead of like an IV here, it goes into the arm, up the brachial vein, or the subclavian vein, into the superior vena cava, the heart, It's just an access point for an IV.
So long, like long.
Fancy IV,
long-term
fancy IV, long term.
I know that you're not supposed to, but I've never understood why having a lymph node or like a mastectomy affects the blood pressure.
So it affects their lymph system.
Okay.
So if they had lymph nodes removed on the right side, and I take a blood pressure on the right side,
Yeah.
you've now added compression, extreme compression to that site, which damages that prior operative site,
Okay.
and they will have a ton of swelling, so they'll develop a lymphedema.
Okay, so it doesn't have
Okay.
anything to do with the blood pressure being
No.
inaccurate. Gotcha.
They'll develop a complication we call lymphedema or pain.
Is that the same when someone has like a breast cancer? Surgery?
If they've had a bilateral mastectomy, you can ask